to the last session of the day, or the last group of sessions of the day, I believe. I'm Antonia Sawyer. I'm the founder and CEO of the Indiana-based nonprofit Ship Happens. That's with a P, not a T, but shit does happen, which is why we exist. We have a mission of getting as much naloxone into the hands of as many as possible, and we are really excited to be sharing some additional programming with you. Everything we do is centered around people who use drugs. We are Indiana's mail-based harm reduction programming, so we provide naloxone via the mail, safe use supplies, and are about to launch our Acute Curiosity HIV home-based testing campaign, which is going to be fantastic for all of our participants. So, are you guys ready? Who's ready? Come on, yeah. We're ready. Okay, here we go. So welcome to Prevent Pricks, a community-based sharps disposal programming initiative. These are some of my harm reduction superstars from Indiana. We've got Julie Foltz here. She runs the Syringe Service Program in Madison County. This is Miami County, where we piloted the program. We've got some community champions here. And then we've got fantastic Carla Wright down in Jennings County, who has also been able to implement Prevent Pricks. So what is Prevent Pricks? This is a super spectacular, innovative way to really start to normalize syringe use within communities and to reduce syringe use stigma. Ship Happens is a harm reduction organization through and through. We value all the principles of harm reduction, and that is equitable and accessible services for everyone. However, we understand that not all communities are ready for full comprehensive syringe service programs. Some rural communities in Indiana don't even have naloxone access. Their law enforcement still refuses to carry, or you have to go to your local health department to access it. You don't have secondary distribution and things like that. So this is a program that we wanted to initiate after a failed syringe service program attempt. And I use the word failed because I can't think of a better word for it. But really it was a learning opportunity for us to take, oh, there's just going to be syringe litter. People who use drugs don't care about their health. Why would we implement public health strategies in the community that help people to inject drugs? And we went, okay, how do we play offensive game and start tackling some of those false narratives in the community around syringe service and kind of normalize syringe use for everybody. So today we're going to talk about, well, Prevent Pricks, which if you haven't gathered, I love a double entendre. So we've got Ship Happens, Prevent Pricks, Acute Curiosity. And so, yes, this Prevent Pricks is a double entendre. We're also going to learn how Prevent Pricks tackles health inequities and is a building block to harm reduction, which is why all of you are in these seats today. Share tools for replication. So if you hear something that you're like, this would be fantastic in my community, we want to help you implement this and tailor it to the needs of your community. And then we'll have a discussion. I believe the discussion is after the second presentation. So if you have questions, you can stop me throughout the presentation, or we can just have an open discussion afterwards. Are we ready? Any questions before we get started? We're right on. Okay, so what is Prevent Pricks and why is it important? First and foremost, it's equitable and accessible ADA compliant sharps disposal for syringe using residents in a community. What Prevent Pricks does is it takes away the why do you use a syringe and says, if you use a syringe, you should have access to a public health strategy that allows you to equitably dispose of your syringes. We take these ADA compliant kiosks and we strategically place them in community places. We work with law enforcement to find where our improper disposal calls are. We work with the health department to identify kind of some of the hepatitis C and HIV rates within the community because we want to reduce communicable disease. We work with our street department. The Prevent Pricks name came from our street department workers getting pricked by putting their hands in the trash cans and throwing the trash onto the trucks. And so what we do is we take that data and we place them in these very strategic places. These are never under surveillance. They will never be on local government property, inside police department lobbies, at health departments, at CMHCs, FQHCs. We really want these to feel like they are equitable no matter why you're using a syringe. So how is that a building block to harm reduction? Well, we understand that we need public health strategies in our communities that impact the health of all residents. And that's what equity means. And that's a value of harm reduction, right? We want to make sure that our participants have access to programming. And we want to remove the criminalization of the syringe. We want to remove the stigma around the use of the syringe. and we want to reduce communicable disease transmission. And so we thought, well, offensive game. If there is going to be syringe litter, let's take care of it, because we have syringe litter without a syringe service program. That is just a fact in our communities. If people don't care about their health, we're going to tackle that and say, okay, well, then no, don't use them. If it's only people who use drugs that are responsible for these syringes on the ground, then not one fucking syringe will be in that kiosk, because they don't care about their health, right? Wait till you see our data. We're going to have to say otherwise. And it also really gets, these are gatekeepers we're working with. So we're working with the mayor, prosecutor, chief of police, health department, our fundraising entity at the United Way. These are the gatekeepers that we're really trying to get them outside of their traditional roles and put the community first. So we're saying, we understand that you probably carry these stigmas and feel like this is a moral failing, but why is the burden of syringe disposal on people who use syringes? That we could have chronic disease, we could have substance use disorder, we could have vitamin injections for our chickens, which does happen in Miami County, but why is that burden on the community? That really is on our local government and our economic development authority to be increasing the health in our communities. And then this last one, this is the WIFM, or the what's in it for me. When I go to the mayor, he's like, all right, you're crazy. What, you have another cocked up plan. What's in it for me? Well, in the United States, an estimated needle stick cost can cost anywhere from $500 to $4,000 per prick, okay? And on average, we were having 1 to 2 pricks reported to OSHA through our street department annually. So by the upfront cost of the kiosk, I'm saving you $8 grand a year. Now let's multiply how many pricks have we had in the last 10 years? That's not even equating when, you know, you're, well, let's see. How would you feel if you got pricked by a needle in the trash can? Worried about getting it. Would you think your quality of life would be great after that, or reduced after that? Before you found out your status and
Probably.
yeah, absolutely. So this is just, let's get the labs done. He has to take time off work. You got to keep going there for 16 weeks, 16 months, however long it's going to take you to, you know, clear yourself. But that quality of life is diminished. And unfortunately, people aren't really concerned about the quality of life for people who use drugs. We are as harm reductionists. So this is people thinking, wait. Steve's quality of life is going to decrease. I like Steve. Steve goes to church with me. Okay, well, a person who uses drugs, quality of life is just as important, and he goes to church with you too. So let's start doing programming that's going to impact everybody. Okay, so the impact of prevent pricks. I'm going to spotlight Miami County, which is the county we piloted this program in. We are now in 5 additional counties across the state. So first, we wanted to increase access to proper syringe disposal. We collected 1/2 ton of syringes in our first year across 3 separate kiosks in the county, and we do not have a syringe service program. That's 12 months, 1/2 ton. And after talking with our waste district, she expects we will exceed 1/2 ton this year. So we're set to even exceed this now that we have more marketing, more visibility, and we're about to put 4 more kiosks in the same county. So we'll have a total of 7 in one community. We want to decrease the risk factors associated with needle pricks. Like I mentioned, we eliminated OSHA reported pricks through our street department entirely. We also have a functioning 0 for needle pricks for residents, which we want to stay at that. We want to be responsive. I'm not in this reactive mindset of, oh, a kid got stuck at the park, now we should lose our shit. No, let's do something about it, and then a kid never gets stuck by a syringe. We have decreased the reported of improper syringe disposal calls by nearly 30%. So individuals in the community were calling law enforcement and saying, hey, I found a syringe in my rose bed, I found a syringe in the street, I found one behind the church. So not only have we decreased those calls, which has increased awareness on how to properly dispose of syringes, we have also been able to reallocate those resources elsewhere. And the best part is removing unwarranted police presence within neighborhoods. We don't need police officers driving around neighborhoods, freaking everybody out. We are totally capable of disposing of a syringe properly by ourselves with proper education. So that's been fantastic as well. We have also decreased syringe stigma across the community. So before Prevent Pricks, someone would take a picture. I found a syringe. Oh my gosh. I don't even have to say it. I don't want to say it because we're recording, and I would never want those words to come off my lips of what they would say about why that syringe was there. Take a picture of one now. They're like, hey, there's a kiosk on Canal. There's one behind Walgreens. There's one over at the Waste District. Call Debbie. I think she's putting one over in the county. Now they're talking about, oh, well, go dispose of it, Susie. Why are you posting a picture of it on social media? You know, take care of it, right? And so that is really impactful because as a mail-based harm reduction organization, this builds into future infrastructure of potentially being able to ship syringes as well and be a comprehensive syringe service program. So I'm eliminating we don't have proper syringe disposal. There's going to be litter everywhere. People who use drugs don't care about their health. Well, we have longitudinal data to prove otherwise. So now I've shut them down. Now they're kind of like, okay, and you're not a brick and mortar and we don't have the NIMBYs. Sounds good to me. So that is really the ultimate goal for the Prevent Pricks program. So what does collective impact look like in the expansion of Prevent Pricks? This has been a bumpy journey for us because this was something that had not been done in our state in a collective way where there was like a process or a toolkit or people who were like, hey, collect this data, or these are the working group members that you need to have. So that was something that we created. We worked with the IU Center for Rural Engagement to publish and copyright a Prevent Pricks toolkit so that communities can implement this and learn from our bumps in the rug. I don't believe anything's a mistake. I think everything's a learning opportunity, but hey, if you don't have to get chased out of town with pitchforks and torches, then don't. Let me do that. We've had the regionalization of Prevent Pricks, the high intensity drug trafficking area of Indiana, recognized the impact of the program, had some funding they needed to offload, which that's going to be one funding tip I'm going to give you. Prepare yourself to be ready for someone to say, it's November, I've got to get this money off my books. Can you take it? We wanted you to invest it here. Yes, I can. How much do you have? And I remember they asked me, they said, how many kiosks would you want if we could give you as many as you wanted? And I said 190 of them because I wanted to put 2 in each county. And they said, okay, we have money for 4. I was like, okay, well, whatever. You asked me how many I wanted, so I'm going to go ahead and go big. So that's been fantastic. And the cross-sector collaboration and communication, I've mentioned the high-level gatekeepers we're working with. And we work with these gatekeepers because from an advocacy standpoint, I need to work with them to get them off my participants' backs. I am trying to do anything in my power to advocate for them and say, let's inch you closer to decriminalizing the syringe. We're not going to cruise the kiosk. If someone says I'm on my way to the kiosk, we're not going to arrest them for possession of a syringe. We're not going to profile people who look like they might use the kiosk and those who don't. And that's one thing the community has really helped us do is they post about the kiosks. They say, this is awesome. I love this. Someone bitched about it and said, we want to move it. They took our parking spot for fishing. And they were like, I don't care. You can park there 170 miles of the Wabash, park somewhere else. We need the kiosk. So now they're defending their own resource, which is really fantastic. And we've expanded. So we've got Miami, Grant, Madison, Jennings, Tippecanoe is getting a kiosk, and we had one in Cass County, but unfortunately, some of the partnerships fell through to sustain it. And so we went and picked it up, and we're going to put it in another county. But, you know, 5 out of 6 ain't bad, and there's going to be hiccups. And I think the main takeaway is the collaboration and the coordination to get this sustained within communities. So how do you expand Prevent Pricks? Leverage state partnerships to identify the current need for syringe disposal. I think assessment is the first thing. Who's already disposing of syringes? Who's not? How is it being taken care of? What are the hepatitis C, HIV rates? What does other communicable disease look like? We don't want to step on or bulldoze anyone. We want to complement and collaborate with. We expanded syringe disposal. Our waste districts still take syringes. They just take them in larger quantities now that they have all these kiosks. Identify your cross-sector partnerships. I can't say that enough. The easiest part is buying the kiosk. That's the ordering it from the catalog. That's the easy part. Getting it embedded in the system to where the street department picks up the syringes and they're trained in OSHA. They take them to the waste district weighs them, incinerates them, collects all our data for us, reports back quarterly. So I think it's really identifying the partnerships you need and identifying the money. Funding is always an issue. We did find a new stream of funding through the Environmental Protection Agency. I think EPA is a fantastic place to get money. They unfortunately weren't having an RFP in Indiana, but I think it's a great way for you to say environmentally, we are capitalizing on current resources, we're cleaning up the environment. And so if you need a sell on that, I think I have a whole piece of a grant I wrote that talks about that. And then you want to launch. The launch is the fun part, but it's really the impact that it has on the communities that is the ultimate best. So I think with that, questions will be taken after, or if we have time, you can ask me.
Thank you.